Order. End of question time. The clerk will now proceed to read the order of the day.
Item 1, resumption of debate on the budget statement.
The question is that Parliament approves the financial policy of the government for the financial year 1st April 2022 to 31st March 2023. Ms. Carrie Tan.
Mr. Speaker, I am thankful that Minister Lawrence Wong mentioned mental health in his budget speech this year. COVID-19 has seen the mental health of care workers, caregivers, and I shall refer to them as carers. Their mental health has deteriorated significantly in the past 2 years, and many news articles have come out recently, documenting the stress that they've come under due to the disruptions brought by pandemic, whether they were social workers, teachers, healthcare workers, mental health workers, or informal caregivers. As my colleague, Honourable Member Mr. Louis Ng mentioned in his speech last evening, 56% of social workers had mild to severe anxiety during the past 2 years. Such statistics point to an increased risk of burnout amidst a lengthy pandemic and the longer term of an increasingly unattractive care sector. It is not surprising that 1,500 medical workers resigned in the first half of 2021, when many of them worked too many hours with inadequate manpower and support. Burnout occurs when people feel overburdened and depleted of emotional and physical energy. And some effects of burnout include loss of motivation, negativity, a sense of failure, self-doubt, and a cynical attitude towards others, as well as a loss of empathy. Empathy is the bedrock of caring professions, and it runs short when people feel burnt out. What quality of care can we reasonably expect when those who toil in our care professions and social services are stretched too thin? In charting a new way forward together, we need to protect the well-being of those who take on the work of caring for others. Because people can only provide quality care when they themselves are well, physically, mentally, and emotionally. Two things are vital to ensure quality care: adequate capacity and adequate recognition. We need to provide sufficient resources and support to carers so that no one burns out. We also need adequate recognition through reasonable compensation and opportunities for advancement to boost morale, motivation, and ensure that the care industry remains sustainable in the long term. Most people who choose the care professions are motivated by a strong desire to care for others, and very few are calculative about monetary contributions and compensations. However, we should still take good care of them and ensure that they have the means to sustain themselves. And hence, my first recommendation is to enhance financial support for informal caregivers. I urge the government to increase the quantum of the home caregiving grant for informal caregivers and implement carefare. Many caregivers shared with me in focus groups last year that they struggle to pay for outpatient expenses that are inadequately covered under MediSave. Such costs add to a family's financial burden, especially for those who had little choice but to give up their jobs and income to care for aging parents, special needs children, or mentally afflicted family members. The pandemic also made caregiving responsibilities and expenses heavier because care resources like daycare centres and domestic workers were short in supply, as shown in a survey done by the Singapore Alliance for Women in Aging, SAWA, in 2020. Enhancing the home caregiving grant will go a long way to lighten their load because finances have shown to be the most significant source of stress for informal caregivers. I suggest that we tier the home caregiving grant according to care recipients' needs and the associated expenses. Care recipients who require assistance with more activities of daily living, ADLs, can and should be supported with higher amounts of grant. Carefare is what I proposed before as a scheme similar to Workfare, but for lower income individuals who provide full-time care to their loved ones, not by choice, but by circumstance. Many caregivers who had to quit their jobs suffer a loss of self-identity, decreased self-worth, and emotional stress. Often, the family members who are not personally involved in care work often fail to understand how demanding it is. Carefare is a way we can provide crucial financial relief and offer recognition for informal caregivers to the labor of caregiving. I will now speak a few words in Mandarin. 我建议政府提高给予非正式看护者的经济支持。我也促请政府增加居家护理津贴的金额，同时推行我之前曾提出的 Carefare。许多看护者与我分享他们面对的种种挑战，包括无法负担一些门诊费用，这些门诊费用不能使用保健储蓄支付，因此增加了这些家庭的经济负担。对于那些为了照顾年长父母、特需儿童或者有精神疾病的家人而无奈放弃工作的看护者，更是雪上加霜。新加坡妇女老龄化联盟在2020进行了一场调查显示，看护相关的资源，例如日间护理中心和帮佣等费用，因为疫情而出现短缺的情况，更加加重了看护者的压力和经济负担。经济问题往往是看护者最大的压力来源，而增加居家护理津贴可以大大的减轻他们的负担。我提出的 Carefare 与现有的 Workfare 就业入息补贴计划异曲同工，但所帮助的是那些因为环境不允许而必须全职看护身边人的低收入人士。许多必须放弃工作的看护者，同时会失去自己的身份认同，失去自信，也面对许多心理压力。时常，即使是身边的家人，由于没有亲身参与看护工作，往往不明白这其中的辛劳、辛苦和牺牲。Carefare 能够提供重要的经济支持，同时认可看护者他们的付出。I will now continue in English. Second, we need to ensure adequate national resourcing for social work, social services, healthcare, and mental health care to be adequately staffed and well protected from work hazards. Beyond salaries, we can do more to enable their work and support them in their well-being. In the healthcare sector, on top of burnout, cases of nurses being physically or verbally abused and even sexually harassed by patients are increasing. More preventative steps need to be taken to ensure that healthcare workers remain safe and supported at work. I encourage MOH to look into proactive policies in hospitals and other healthcare settings to protect our healthcare workers from abuse. We could also consider amending our laws to toughen punishments for those who abuse healthcare workers to send a very clear signal that such behavior will not be tolerated. Beyond just improving salaries, we need to ensure safety, support adequate staffing to retain and develop individuals in the care sector for as long as possible to adequately meet the needs of our aging population. Similarly, we need to protect our teachers from burnout. The role and workload of teachers have expanded drastically over the years, and yet teachers face more challenges as well as increased expectations on them with home-based learning and the rising concern over youth mental health. In October last year, there was a letter written from a Mr. Ng Wei Yang to ST, and his plea went, "My wife's a teacher. Can I have her back with my family, please?" I have spoken about this before in Parliament, and I caution again about putting dual responsibility on teachers to double up as counsellors amidst a already overwhelming workload. Although teacher counsellors will have a reduced teaching load, I am concerned about whether they will have sufficient bandwidth and emotional capacity to do both effectively while maintaining their own mental health. Some teachers shared with me that providing students with some form of basic counseling is already part of their role, and they do it quite organically. However, I am concerned that formalizing this role could create even more expectations by parents and the public towards teachers. The mental health of our teachers is next on the line if we continue to load them with too many expectations. I hope the Ministry of Education will augment its efforts in this area with effective stakeholder communication towards parents. On top of that, other than being trained in youth psychology, the ministry could also consider adding on training in family therapy for school counselors. School counselors need to be well-versed in the everyday struggles faced by youths, including those they may encounter within their families. Other skills such as mediation could be helpful to foster and bridge relationships between students and their parents, especially during the difficult adolescent years. Within the wider community, I urge MOE, MSF, and MOH to jointly resource and enable the training of mental health responders and volunteers from the grassroots to be empathic listeners. Our PA Grassroots Network has been a formidable and dependable way to outreach to residents in times of need, from mass distribution to mobilization for vaccination, and in pre-COVID times, organizing activities to bring people together. We can tap on this network further, provide targeted training to suitable members, and build their capabilities in one-to-one care support to residents. Social service agencies can partner with PA to train and equip volunteers as befrienders in the community for anyone who needs a non-judgmental listening ear and guidance on further resources for help. Someone facing mental health struggles may not need to see a counselor if they feel listened to early on in their difficulties. Those who require more attention and expertise can be advised by the befrienders on where to get more support. This pool of volunteers serve to help distribute and mitigate the care load from the limited number of existing professional counselors until we can train more to handle the needs in the system. I am piloting this in Nee Soon South with the support of Yishun Health and Health Promotion Board this year, and I look forward to share our learnings to help build this community care network model in Singapore. Lastly, we need to enable social service agencies to improve their capacity building capabilities. Increasing funding from private, corporate, and philanthropic donors can help reduce the SSA's reliance on government funding and the government's administrative workload. I am heartened by the budget announcements that the government will provide a 100 million top-up to continue the dollar-for-dollar matching to donations to charities until end 2024. And we should use such support to encourage private philanthropists and corporate donors to finance capacity building in Singapore's social service agencies for roles and headcounts such as volunteer management, marketing and communications, and fundraising. Getting multiple sectors to sponsor and support diverse and value-adding job roles to careers in SSAs will make the sector more attractive and vibrant for Singaporeans. This helps to increase the non-profit sector's capacity and brings 3 wins. 1, it reduces the stress that SSAs often experience due to public funding limitations and large reporting and bureaucratic requirements. Number 2, it allows for more experimental approaches to support vulnerable communities. And 3, it frees up government monies to be directed to the professional training of additional social workers and healthcare workers. The Charities Capability Fund by MSF, as well as the Community Capability Trust, are steps in the right direction, and I'm glad for the 26 million top-up to these efforts. I look forward to the implementation details and hope it will be a simple process for SSAs in its execution. Mr. Speaker, a mentally healthy nation is a strong nation. The mental health of those who take on the brunt of care work in our country is an immediate priority. We need to help redistribute their care load. In the year ahead, I urge more attention and creative resourcing to look after the mental health of our carers. In Mandarin, 人民心理健全，国家才能是个强大的国家。如果我们能够更好地照顾我们的看护者，那他们也能更好地照顾其他人。I look forward to coordinated plans by MOH, MOE, and MSF to enhance their support and care of our care workers. If we take better care of our carers, they can care better for many more. Notwithstanding the above that beg further attention, I fully support the budget. Thank you.